And this is Interstate 640 at 75. Things look pretty calm there. But just take it easy. Be kind to everybody. Welcome back. 5.7 million people in the U.S. have heart failure. And despite this, treatment can now allow people to live productive and active lives.
Dr. Bob is here to talk more about heart failure, the causes, the symptoms, and the treatments. How are you?
Fine, doing great. The heart is an amazing organ. It's about the size of your fist. It lies on the left side of the chest, near the middle, but on the left side. It throws blood up to the lungs where the blood grabs oxygen, goes back to the heart, and then the heart sends the blood back out again to the rest of the body for nourishment so that the muscles in the body can survive. Now, there are some things that can go wrong with the heart. It beats about 60 to 80 times per minute. That's 100,000 beats per day,
Sheesh.
30 million beats in a lifetime. So it's a real muscle that we count on. There are some things that can go wrong. Number one, we can have some disease of the heart muscle. We call it myocarditis, inflammation. It can be viral or bacteria. We can have coronary artery disease. The heart is a muscle. It has to have its own blood supply. That's the coronary arteries. If they are sick or not doing a good job, then the heart doesn't do a good job. There's high blood pressure. The heart has to throw about 5.7 liters of blood out through the body with each beat. So if there's high blood pressure, the heart beats against that, and it can make the heart actually tired, and we can go into failure. If there is heart failure, that just means the heart can't pump the blood out as good as it's supposed to. So people get shortness of breath, they get fatigued, they don't feel good, their legs start getting edema, where they get fluid in the legs and they get puffy. When that happens, the person usually knows that they're short of breath when they walk with activity. They sometimes have to sleep on 2 to 3 pillows in order to have enough breath at nighttime in order to be able to sleep well. When they go to the doctor can get a chest x-ray, electrocardiogram, can get special tests that can tell if the person is in heart failure or not. And then if heart failure is established, then there are wonderful medicines that we can take. For instance, there are diuretics that we take. We've got the fluid in our legs. The diuretics will help get that fluid out. There are blood pressure medicines that make it where the heart doesn't have to beat as strong against a blood pressure there. So there's ACE inhibitors, ACE receptor blockers, beta blockers. There are calcium channel blockers. So there are excellent medicines. There are medicines that actually make the heart beat stronger. So if the heart's getting weak, if it's not getting its nourishment, then some of the medicines like digitalis, digoxin, they can make the heart beat stronger itself. Once we get the heart failure regulated, then we have nutrition, we have low salt diets, we eat well. Activity is part of it. So people need to exercise. They need to be sure that they're sleeping properly and don't have obstructive sleep apnea. So there's a lot to do after the diagnosis is made, after the patient gets better, to keep that patient better so that they can live a very productive and very normal life. Heart failure is not good. The lifespan is shorter than somebody, but there's a lot we can do to live happy and healthy for a period of time.
All right, Dr. Bob, thank you.
All right,
Good to be here.